Welcome to the second Sutter Health Research Symposium. This symposium brings together talented researchers, clinical scholars, and research enterprise to share the knowledge that you have, the discoveries that you make, and to celebrate all of your achievements.
To do research, you have to be curious, you have to have questions, and I think that says it all for all of us here.
The clinical trial is not research, it's hope. It's hope for life. That is our mission. Not for papers, not for patents, but for our patients who show up every day looking for answers, looking for solutions, for hope. And that's what you represent.
At Sutter, we're thinking about how to grow future researchers. In most spaces, research sits in one silo and academics and education sits in another silo. We're bringing those together under the umbrella of academic affairs. We're thinking about how we can amplify each other's work and ultimately also asking great questions about the clinical concerns that are arising in our environment and how we can address those better.
There are certain unmet clinical needs with some of the new therapies for Alzheimer's disease, and we're trying to close those gaps with alternative treatments for patients. One option is expanding on the research that we've done in the past with another form of passive immunotherapy, which might be a nice option for patients who are ineligible for medications like lecanemab.
Over the last 1 decade, there has been great improvements in melanoma care. We've been working on cell therapies, trying to rescue those patients using their own patient tumors to make into the vaccines.
All I can say about the trial is that this is the reason why I'm here today. I can't tell you how thankful I am to researchers in the field for doing what you do, because I would not be standing here without you, and I thank you all very much.
Every patient comes in with very unique set of characteristics. You learn from every patient. Why does melanoma spread? When it spreads, and to what areas does it spread to? So we developed a new algorithm to really predict what is the risk or the probability of their cancer spreading to lymph nodes. We looked at the accuracy of the algorithm, and it's 10 points better than anything that has been published.
Research is just clinical care for unmet clinical needs. So it's part of our mission, it's part of what we have to offer our patients when we take care of 1% of the national population.
I want to thank you for what you do. The impact that you have and the impact that you can have is tremendous. And it's in our hands now to make it better.